So let's talk about the turbinates in nose. So to understand the turbinate in nose, we have to understand the anatomy. So you can see this is the lateral wall of nose. So you can see this is inferior concha, it is middle concha, it is superior concha. Okay, and near to the concha is the anterior wall. Upper third of nose, you can see this is upper third of nose. It is connected to the brain through the cribriform plate. This is cribriform plate, and it is connected to the brain. So infection from this area can goes in brain through the cribriform plate. Okay, so it is a dangerous area, and okay, it is mostly lined by the ciliated columnar epithelium. Okay, so anatomy of lateral wall of nose. So anatomy of lateral wall of nose, you can see this is superior concha, this is middle concha, this is inferior concha. Okay, and near to the concha, that is turbinates. Okay, these are the superior turbinate, middle turbinate, and inferior turbinate. And you can see upper third of nose. This is upper third of nose. It is near to the brain. It is near to the brain and connected through the cribriform plate. So you can see infection from this area can goes to the brain through the cribriform plate. So this is dangerous area. Okay, because infection from here can go into the brain. Okay, it is mostly lined by the ciliated columnar epithelium. Okay, now you can see this is the front part of nose, and this is mostly lined by the stratified squamous keratinized epithelium. Okay, now we have learned that we have three concha or turbinates. Okay, and we have three meatus. These are the superior meatus or concha. Okay, sorry, these are the superior concha or superior turbinate. This is middle concha or middle turbinate. This is inferior concha and inferior turbinate. These are forming the lateral part of nose. This is nose. This is one compartment. This is another compartment. And in this one compartment, there is a lateral wall. And in lateral wall, you will find superior turbinate, middle turbinate, and inferior turbinate. These are also known as superior concha, middle concha, and inferior concha. And near to the concha, like this is superior concha or superior turbinate. So near to the concha is superior meatus. Okay. And it is mostly lined by the ciliated columnar epithelium. In front of the nose is only lined by the keratinized epithelium. Okay. Now superior turbinate is the smallest. Okay, it is smallest. It is only constituting posterior one third. Middle turbinate only posterior half. This is only like this. This is the entire nose. So posterior one third, it is superior concha. Like posterior half, it is middle concha. Okay, and the inferior turbinate occupies the entire nose. Okay, and inferior is independent bone. So this is superior turbinate, middle turbinate, inferior turbinate. Okay, are you getting the point? What is the position of these three concha in nose? Okay, superior is posterior one third, middle is posterior half, and inferior is entire. Are you getting the point? This is the entire nose lateral wall. So inferior occupies the entire lateral wall, middle occupies the posterior half, and superior occupies the posterior one third. Okay, now the inferior, it is largest, occupies the entire bone, entire nose, and it is independent bone. Okay, now there are various opening. So this is superior turbinate, and this is middle turbinate, and this is inferior turbinate. Now we have this is superior meatus, this is in middle meatus, this is inferior meatus. So it has various opening. So inferior meatus has largest opening. It has nasolacrimal duct opening at the level of anterior one third and posterior one third. So this is anterior one third and posterior two third. So in between these there is opening, that is nasolacrimal duct opened here. So nasolacrimal duct connected nose to the lacrimal gland. Okay, it get opened here. If it get obstructed, if this, are you getting the point? We are forming, this is the lateral wall. We have formed the lateral wall, and if there is obstruction at nasolacrimal duct, obviously patient will have watery eyes. Okay. Now treatment. So treatment, you have to give criclar massage. So criclar massage is, we give downward, backward, and laterally. It is the direction of duct. So we have to give in this direction, criclar massage. Okay. Now during breathing, air passes through the middle one third of nose. Okay. and 10 to 15% reaches the olfactory epithelium. Okay, so we have learned about the opening in inferior meatus. Let's talk about the opening in middle meatus. Okay, this is inferior meatus, this is opening in inferior meatus. Let's talk about the middle meatus. So middle meatus has opening of mouth. So what is mouth? M is for maxillary sinus, opened here. Anterior and ethmoid sinus and frontal, these three sinus open into the it is the most congested. Okay, and it has also hiatus seminaris, infundibulum and bulla ethmoidus. So these all are the structures. Like this is bulla ethmoidus, it is hiatus seminaris. Okay, these all are the opening are present in middle meatus. Now superior meatus. So superior meatus, you can see this is the posterior ethmoidal air sinus opening in the superior meatus. Okay, so you have to understand about the anatomy of all these three meatus and what are the opening in various. You have to understand the anatomy of all three terminates and all three meatus. What are the opening in each meatus? Because they will ask you a question. Okay, definitely they will ask you a question from the anatomy. Now there can be two things in terminate. It can be airfold, so it is concha ballosa, mostly in middle meatus, or it can be hypertrophied, so it is mulberry appearance. In case of hypertrophied, you have to do partial turbinectomy. You have to release that turbinate partially if there is congested or there is hypertrophied uh, any hypertrophied any turbinates. Okay, so this is the entire lateral wall of nose or turbinates anatomy. So this is a rapid revision. These are the notes from my rapid revision course, which is present in my app, Dr. Priyesh Nayak app, which is available on Playstore app or Appstore. We have also one video free, that is nose. If you want to watch that video for free, you have to just download the app and you can go in nose section. You can go in free content and you will find a nose video. And if you like the video, then only purchase the course. Otherwise, you can continue with your old source. You need not to waste your money. Okay, thank you so much.